It's all about nervous system development. Okay, and the nervous system actually starts to develop at day 21 post-conception. Okay, that's an important point. And what you see here are 4 different drawings. Okay, we're going to start out here on the top left. That's going to be number 1, going to number 2, then number 3, and number 4. So these are all different steps that happen starting on day 1 in the embryo, or day 21, sorry. All right, so what you see here are, this is the future embryo, okay? You see 3 different layers. The uppermost layer is called the ectoderm. E-C-T-O-D-E-R-M. It's the uppermost layer, and the ectoderm will become the future central nervous system, peripheral nervous system, and skin of the embryo. So it's going to be the outer layer, CNS and PNS. The layer immediately under the ectoderm is known as the mesoderm. And that's your middle layer. Okay, your mesoderm or middle layer is going to become the future muscles and skin of the baby. Okay. And then in the middle, or the very lower portion, you have what's known as your endoderm layer. Essentially, your endodermal layer is going to be the future GI system of the baby. Okay, so at day 21, this is where you're starting. The embryo has 3 different layers you need to know about. The ectoderm, that'll become future CNS, PNS, and skin of the baby. The mesodermal layer, which is the muscles and skeletal tissue of the baby. And then the endodermal layer, which is the future GI of the baby. Okay, yes, that's right. Muscles and, no, it's muscles and bones. Yes, should be muscles and bones. Thank you. Skin's the ectoderm. Okay, any other questions? I think what I was thinking of is writing skeleton. It came out skin. But muscles, bones, skeleton, any way you want to think about it. It's the stuff in the inside. Okay, just under the skin. Any other questions? Is that pretty straightforward? And it turns out that as early as day 21, you know the top of the baby from the bottom of the baby. This structure right here is going to represent the future mouth of the baby. So that's more rostral. Okay. That's known as your prechordal plate. Prechordal plate, PLT. And that's the future mouth of the baby. And that's going to be more rostral. And running, there's only one more structure you need to know about, and it's this structure right here. Okay, what you see here is a cross section through the middle of the 3 layers, and this structure actually runs all the way through up to the prechordal plate, all the way through the mesodermal layer. Okay, so this structure is known as the notochord. That's your notochord. And like I said, you see a section through the 3 layers. It's clearly in the mesodermal layer here, visible, but it runs all the way through the mesodermal layer right to the front.
Yeah. What does the green one say again?
Notochord, Notochord. Any other questions? Is that pretty clear? So what's going to happen is as the embryo develops, the ectodermal layer is going to fold around on itself. So you're going to have the ectoderm on the outside for the most part, except for the CNS and PNS. We'll talk about how that develops here in a minute. And then you're going to have the muscles and the skeleton underneath the skin, and then your GI system is going to be in the middle. So essentially you're forming the baby just by folding it over on itself. Okay. Now what happens now, this is going to be step 1. Okay, step 1 develops into step 2 here. And to go from step 1 to step 2, this notochord has a job. It releases something known as growth factors that specifically stimulate the growth of all the tissues over top of it in the ectoderm. And that's what you see here. So you can see here's your notochord. Notochord. You have your 3 different layers here. Here's your ectoderm, your mesoderm, and then your endoderm. And there's your notochord that releases growth factors. And you can see that the release of growth factors has caused the growth of this area in the middle of the ectoderm. So that notochord releases growth factors that cause the thickening or the growth of a specific area in the middle of this ectodermal region. And it forms what's known as the neural plate. Kind of looks like a plate sitting up, right? So here's this area here. Called your neural plate. And your neural plate is nothing more than the growth or thickening of that ectodermal layer over top of your notochord due to the release of growth factors. And you still have your prechordal plate here. It's the future mouth. Okay, questions about that? So as you go through development, you're going to start with ectoderm, mesoderm, and endoderm. Notochord releases growth factors that causes a thickening or a growth in the ectodermal midsection, and that forms what's known as the neural plate. Okay, neural plate, the next step, which is going to be down here, is step 3. So you're coming across to step 3. Okay, same structure. So we can go ahead and, here's our prechordal plate, still there. Here's our notochord, still there, and our 3 layers of ectoderm, mesoderm, and endoderm are still there. The only thing that's really changed is this neural plate in the center. See that? And what happens is, if you can imagine, this piece of paper is the neural plate. What I'm trying to represent here in 3 dimensions is that neural plate starts to sink in on itself. So you form this little tunnel or groove-like structure. So everybody see that? So if this were the neural plate, what this represents is this just kind of collapsing up like this, forming a groove. This is called your neural groove now. So again, this is just your neural plate folding in on itself. And the neural plate transforms into the structure known as your neural groove. Okay, that's your third step. And then your fourth step is with the last picture. Again, you have your notochord in your mesodermal layer. You have your prechordal plate and your ectodermal layer. All three layers are still the same. The big change that you see is now this neural groove that has started to kind of fold in on itself has become fully folded in, and it becomes a tube. Okay, so if the piece of paper is the groove, that groove then just folds completely in and becomes a tube. Okay, so this is known as your neural tube. Okay. Your neural tube, this structure right here in the middle, that's the future CNS of the baby. So that will turn into the central nervous system of the baby. Bless you. In addition to this neural tube formation, as it forms the tube-like structure, some of the cells on the top of the tube actually fall off to the sides. Okay, do I see that? So this is your neural tube here in the middle. These cells that fall off the top of the neural tube become just cells embedded adjacent, and those are known as your neural crest cells. Your neural crest cells are your future peripheral nervous system, or PNS. Okay, all this happens about day 21 post-conception. That's pretty early in pregnancy, so it's really important to take pretty good care of yourself for a healthy nervous system for the sake of your baby, okay, if you're female. Questions about that? There's something really important that happens about day 21 here. Once this neural tube is formed, you can see that the tube has a hole. If you imagine the tube like this, right? It has a hole up top, and it also has a hole down the bottom. Okay, those holes have special names. The special name for the hole up top is called your anterior neuropore. Neuropore. And that's nothing more than the unclosed hole at the top of the neural tube. And this hole that is visible here at the bottom of the neural tube is called your posterior neuropore. Yes. Ben. I'm sorry, I can't hear you. They start on day 21 and progress forward through day 28. So it takes about a week to get to the next step. Okay? But all this is happening within the course of a week. You can imagine just a movie rolling forward. It takes about 7 days to complete all these steps. We'll talk about what happens in day 28 here in a minute. But first thing we're going to talk about is the anterior and posterior neuropore. Now, like I said, this is the hole at the bottom end of the central nervous system, which would be kind of the spinal cord area. Does anyone know what the disease name or the medical terminology for the disease is if a baby is born without the posterior neuropore being closed? Yes. Spina bifida. Awesome. Yes. This would, without, and how do you prevent spina bifida from happening? Folic acid, yeah, folic acid supplementation or lots of dark leafy green vegetables, okay? So in the absence of that, if this doesn't close, then you get spina bifida. Okay, with spina bifida of lots of different kinds, it's beyond the scope of this course to talk about them. You're going to learn all about spina bifida next year in pediatrics in your fall semester. That's Dr. Friend. And there's another one. If the anterior neuropore doesn't close, does anyone know what that one's called? And that's a terrible thing. The baby is actually born without a cortical region. So if it doesn't close, you have the brain stem formed, and then you have the meninges covering it, and there's no skull over top. Okay, so the baby's born without the top of its skull, and you have exposed brain into, yeah, it's called anencephaly. Okay, without closure of the anterior neuropore is anencephaly, A-N-E-N-C-E-P-H-A-L-Y. Okay, anencephaly. And again, that's due to lack of folic acid during the development of the central nervous system. Okay, it is not compatible with life. People with spina bifida can go on. I mean, there's different kinds of spina bifida. Occulta, you might not even know you have it, to the highest level. Do you have a question, Josh?
Oh yeah, I was asking, it says anterior what?
Neuropore.
Okay.
That's your neuropore. So that your neuropore is just the hole in the front here, and your posterior neuropore is the hole in the back. And anencephaly is the name of the condition that isn't compatible with life. Babies are born without a cortical region, and they die shortly afterwards. Okay? Folic acid's that important. Okay, questions. All this happens starting day 21, progresses all the way through to the neural tube, which will be the future CNS. What we're going to do now is we're going to start with this neural tube and look what happens on day 28. We're going to look at brain formation. Okay, brain formation is going to happen on day 28. And that's here. Okay. What I'm starting with here is this is just looking at from the front. This is your neural tube. Okay, the neural tube has a closed anterior neuropore and a closed posterior neuropore. Okay, but if you just have that neural tube in front of you, you're just looking at it straight on. Okay, this is going to be rostral, or let's just say anterior at this point, and then this is posterior. Okay, everybody got it? See where I am? I just took the neural tube off of the epidermal layer, off of the baby, and then we're just going to look at how the brain forms from this structure. Okay, as far as brain development is concerned, you're going to have 3 primary brain vesicles. So first step is the formation of primary brain vesicles. Okay, the topmost brain vesicle is essentially this neural tube gets 3 swellings. See, bump, bump, bump. It's like a balloon, and you put a twist in it. Okay, just 3 different swellings start to happen here on the anterior end of the neural tube. The topmost swelling has a name. It's called your prosencephalon. So your prosencephalon, P-R-O-S-E-N-C-E-P-H-A-L-O-N. Your prosencephalon is the topmost swelling that happens in the neural tube. Okay, and these are your primary brain vesicles. So these are the first ones to form. Underneath your prosencephalon, the second swelling is known as your mesencephalon, M-E-S-E-N-C-E-P-H-A-L-O-N. Mesencephalon is going to be your middle brain swelling. And then the lowermost brain swelling is known as your rhombencephalon. So this is your RHOMBENcephalon. So your rhombencephalon. And each of these are your primary brain vesicles. They're just 3 independent swellings that form at the anterior end of the neural tube during brain development. Prosencephalon, uppermost, mesencephalon in the middle, rhombencephalon, more posterior. Got it? Questions? Okay, moving from here, you go from your primary brain vesicles, and the next thing we're going to label over here are your secondary brain vesicles. Your prosencephalon divides rapidly, starts to really divide, and becomes 2 different new secondary brain vesicles, or gives rise to 2 different vesicles. The first is up top here. Okay, this is called your telencephalon, Telencephalon. So your telencephalon, that's going to be your future cortical lobes. Okay, so think frontal, parietal, occipital, temporal, all the things we talked about all semester. And it kind of looks right? I mean, it sort of looks like the lobes of the brain that we've been talking about. There's your longitudinal fissure right in the middle. So that prosencephalon starts to rapidly swell and rapidly divide, and the topmost portion of your prosencephalon creates what's known as your telencephalon. Okay. In addition to the telencephalon, there's another structure here that arises from the prosencephalon, and I'll indicate it by just coming down here. So these are both coming from that region there. And this, just underneath the telencephalon, is known as your diencephalon. Okay, your diencephalon is the future thalamus and hypothalamus of the baby. Interesting to start to think about it now. I talked about it, we started with a neural tube, and this is a hollow structure. It's just a tube. So there's empty space all throughout here. So in the telencephalon, what do you think is the name of the empty space? Lateral ventricles. Yeah, very good. And then your diencephalon, what ventricle is that going to be? Your third ventricle. Great. And then we'll move on down. So if you're in your midbrain, what's the ventricle? Cerebral aqueduct in the midbrain, but the 4th ventricle is going to be in the pons, right? And then going down through the spinal cord, does anybody remember the name of the hole in the, yeah, your central canal. So realize that this hollow space in here is just still going to be hollow, but it's going to form the individual structures that we've been talking about all semester. Okay, so here's your diencephalon. Let's do it this way. So I've got your diencephalon just underneath. That's your future thalamus and hypothalamus. And then your telencephalon is going to be on top of that. Both of these secondary brain vesicles come from your prosencephalon, or the topmost primary brain vesicle swelling. Okay. The next one is going to be your mesencephalon. Your mesencephalon doesn't really change. It's just going to stay the same. Okay, so your mesencephalon is this region here, and that's going to be your future midbrain so prosencephalon becomes two different vesicles, secondary brain vesicles. That's your telencephalon, your diencephalon. Mesencephalon doesn't change. It's still your mesencephalon. Okay, mesencephalon's destined to be your future midbrain. Now your rhombencephalon goes through a couple of changes here. Your rhombencephalon becomes, again, two different structures. The first structure it becomes is going to be represented here. I'll put it in purple. So you have all this area here. It's going to be your rhombencephalon separates into your next secondary brain vesicle. Okay, that's going to be your metencephalon, M-E-T-E-N. Metencephalon. Okay, and then your rhombencephalon also creates the lowermost bulge here. And this lowermost bulge is called your myelencephalon. Okay, that's your myelencephalon. And your myelencephalon is your future medulla. And your metencephalon is destined to become your pons and your cerebellum. See that? Questions? And if you want to follow it around, what happens is that the diencephalon, the telencephalon starts to rapidly divide, and it folds over. You can see it folds over in the diencephalon, or the thalamic region, in the hypothalamus. So that's kind of inside. So it's inside. And then your future midbrain is your mesencephalon. That's just going to stay pretty much the same throughout development. Okay, your diencephalon gets kind of swallowed up by the telencephalon, so I'll make it like this. And then your telencephalon is cortical region, talked about. Okay, then your metencephalon, represented here in the purple, is going to be your pons and cerebellum. Okay, so that's all of this region here. And then your myelencephalon is your medulla. And on the bottom you have your spinal cord. So this is just formation of the brain, or the whole central nervous system. Really, the brain, when we talk about the development of the brain, we're going to look here at another set of drawings, and we're going to look at the development of the spinal cord, also at day 28. But realize that central nervous system development happens very early post-conception, 3 to 4 weeks for a healthy nervous system. Questions? This information used to be at the beginning of the semester. I think it's much easier at the end, only because you now know what all these things are, right? So in addition to learning the rhombencephalon, when you're still trying to learn what the cerebellum is, it's like, I think it's easier at the end. So hopefully that works out for everybody, because I think you can see it. You have a few new words to learn, few more problems with the central nervous system development, but not very much at this point. All right, let's go ahead and look at spinal cord formation, also happening at day 28 post-conception. Last drawing. what I've done here is, in the last slide I showed you the neural tube from the front. All this is a transverse section through the neural tube. Okay, in that transverse section, in addition to the neural tube, I've also captured a couple of neural crest cells. Okay, so I'll label that as, let's say this is a neural tube. It's a cross section. Okay, and these are the neural crest cells. Remember, the neural crest cells are your future PNS. Your neural tube is going to be the portion that turns into the spinal cord. Okay, in the very middle of the spinal cord, like I said, the neural tube is hollow. We have that part that's filled with CSF. This is your central canal. And when I look at a cross-section through this neural tube, I see a whole lot of cells. These are actually neuronal cell bodies here that are directly surrounding the central canal. Okay, these cells have a special name. They're called your mantle layer. M-A-N-T-L-E. Mantle layer. And they are destined to become the future gray matter of the spinal cord. Okay, so think ventral and dorsal gray horns. Okay, that's where our gray matter resides. So your mantle layer, all those neuronal cell bodies in the middle, and then on the outside of the mantle layer, you have all this white matter. Okay, this white matter is known as your marginal layer. Bless you. And that's going to be the future tracts of the spinal cord. Okay, so all those tracts that we talked about way back when make up the spinal cord, they are derived from the marginal layer, the outside layer of white matter that's present in the neural tube. Questions about where I am? Does everybody see what's happening? Just a cross section, marginal layer, lots of cells surrounding the central canal, and then mantle layer, lots of cells, and then the marginal layer is going to be the white matter on the outside of those cells. That'll eventually become all your tracts. Okay, so this develops by having that mantle layer rapidly divide. So you have here's your central canal. Okay, everything comes off the central canal. We'll label that as a reference. You can imagine all those mantle layer cells here, they start to divide, and they rapidly divide and form kind of a butterfly-like shaped structure. So there's going to be a top wings of the butterfly. Okay, and these are just all the cell bodies and the neuronal cell bodies, all that gray matter here. All those cells in the mantle layer rapidly divide to create the gray matter that you see when you look at a cross-section of the spinal cord. Okay, and then the bottom portion, you get the formation of other butterfly wings here bilaterally. And these are nothing more than multiplication, rapid division of all those neuronal cell bodies that were part of the mantle layer. Hopefully it's starting to look a little bit more familiar to you. Okay, those are neuronal cell bodies. So these neuronal cell bodies here in the bottom are known as your basal, B-A-S-A-L, or motor plate. Okay, all those neuronal cell bodies you see in red are your basal or motor plate, and that's your future ventral gray horn. Blue. And then all these other cells that I've labeled in blue, these are also neuronal cell bodies, and they are known as your alar, A-L-A-R, or association plate. And this is your future dorsal gray horn. And the marginal layer itself has a couple little invaginations that we've seen before. That's more of a spinal cord that you're familiar with. And you can't forget about these special cells from the the neural crest cells. The neural crest cells exist out here. And as I said, the neural crest cells are going to be your future peripheral nervous system. And everybody remembers these special pseudo-unipolar cell bodies out here that are your first order sensory neurons, and they reside in your dorsal root ganglia. Right here. Okay, so neural crest becomes your dorsal root ganglia. Questions? Yes, I get to put away my markers for a whole year. All the drawings we are going to do